Today, we're proud to bring you Zoom Advanced Power. It's the fastest, most effective whitening system ever. Zoom Advanced Power is a complete system that gives your patients immediate results and ensures lasting effects long after the whitening treatment. The Zoom Advanced Power Lamp was specifically engineered to activate Zoom's advanced formula whitening gel for superior whitening results. Simply stated, Zoom Advanced Power is better than ever. 50% of patients whiten to B1 or better in just 3 short 15-minute sessions. Place the Zoom protective eyewear on the patient. Note the adjustable arms for proper fit and comfort. Generously apply the protective lip balm SPF 30. As with all lotions, the material will absorb into the patient's tissue, providing a moisturizing, protective layer. Instruct the patient to rest their tongue behind the tongue cup and to lightly bite down. Isolate with the 2x2 gauze included in the Zoom kit. This gauze has been tested and is proven to provide superior protection with the Zoom lamp. Do not substitute your own gauze for this procedure. Place the first piece of gauze fold side down in the upper vestibule, followed by gauze placed fold side down in the lower vestibule. Now place 2 face bibs around the retractor flange. Retuck the gauze into the vestibule if necessary. Open the third 2x2 piece of gauze into a 2x4 piece. While holding the ends of the gauze, roll it lengthwise to resemble a cotton roll. Align the crease with the midline and place it in the upper vestibule. It should cover approximately first molar to first molar, number 3 to number 14. Take the 4th piece of 2x2 gauze and repeat this step for the lower vestibule, covering from approximately number 30 to number 19 in the lower arch. The 5th and 6th pieces of gauze will be placed in each cheek. Fully open the gauze and fold it into a triangle. Place the apex of the triangle into the posterior cheek and tuck the end into the flange of the cheek retractor. Remove the cap and attach the tip to the Liquidam syringe. Be sure the tip is inserted fully into the recessed area of the barrel and lock it into place. A complete isolation requires 60 to 80% of a single syringe. Do not apply Liquidam more than 2 millimeters thick, or it may not cure completely. Begin by applying the dam along the gauze in the upper vestibule to form a seal. Apply to the full arch, or at minimum a single quadrant for proper coverage, manipulating and extruding the material as you go. Make a second pass along the margin, scalloping the gingival margin to ensure full coverage. Be sure to cover all interproximal areas, sealing the Liquidam to the enamel. All dentin should be covered. Cure the application of Liquidam. Liquidam is a resin blend that can become warm. Therefore, use a sweeping motion when curing, moving the light back and forth across the arch for about 10 seconds. Do not leave the light in an individual area for more than 2 seconds. On the lower arch, first apply Liquidam, scalloping the teeth at the margin to allow gravity to pull the material down towards the gauze placed in the vestibule. Again, make a second pass, sealing the isolation materials. Cure the lower arch application in a sweeping motion for 10 seconds. Once complete, use the sweeping motion again on the upper arch for 5 seconds and move back to the lower arch for an additional 5 seconds. Use the tip of the syringe to press lightly on the application to ensure it is completely cured. The material should be solid and have no give. If necessary, cure the arch again for an additional 5 seconds. Check to ensure that all soft tissue is covered and that the gingiva cannot be seen through the Liquidam. If necessary, add additional Liquidam and cure. Use saliva ejection to remove any saliva pooling in the cavity. Open the final piece of gauze and place it between the teeth, over the retractor's tongue cup. Make a final check to ensure no tissue is left uncovered. Use the motto, "No pink," as a standard. Check the interproximal areas of the application, especially on your blind side. Check the entire oral cavity to ensure all tissue is covered. Apply additional gauze or Liquidam where necessary. Remove the cap by rotating a quarter turn to the right. Place the mixing tip at a quarter angle. Rotate left to lock in place. Do not apply Zoom gel directly onto the teeth. Extrude the gel into a dappen dish or onto a mixing pad. Use the brush supplied in the kit to stir the gel and apply it to the teeth. Apply the gel to the facial area of all visible teeth, approximately 1 to 2 millimeters thick. The lamp will beep once when 3 minutes are remaining and again 3 times on the final 3 seconds of the cycle, with one long beep when the time reaches 0. The light will automatically turn off when the cycle is complete. Remove the light guide from the retractor. Gently pull the lamp away from the patient while maintaining the vertical position. Carefully remove the gel with suction and/or wipe the surface of the enamel clean with damp gauze. Take care not to dislodge the isolation materials. Do not irrigate. The force of the water may pull the dam loose and saturate the isolation materials. Check the isolation materials to ensure they are intact and no pink is visible. If the patient notes sensitivity at the margin due to tissue oxidation, Open the vitamin E oil and use the brush to apply the oil to the sensitive area. The vitamin E will help to soothe the tissue and act as a barrier against further gel contamination. The vitamin E oil may be applied to any tissue that has had contact with the whitening gel and may be sensitive or has turned white from the oxidation. Apply the starter swab to the top and bottom arches as before. Bleed the syringe to remove the oxygenated gel and ensure a fresh mix. Extrude the fresh gel into a dappen dish and apply as before with the enclosed brush. Use horizontal movement to reposition the light. At the beginning of each session, note that the number of sessions remaining has been reduced. Attach the light guide to the retractor and press the start button to activate the timer. Repeat these steps for each session to complete the whitening procedure. Remove the light guide from the slots and gently pull the lamp from the patient. Slide the lamp out of the way. Suction or wipe the gel from the teeth. Use damp gauze to remove the residual gel. Use the cotton pliers to grasp the gauze isolation and gently pull. All of the isolation material should pull free from the mouth in one unit. The retractor should remain in place. If the gauze is excessively dry, moisten it lightly before removal. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove with force. Lightly use air to remove remaining material. Now it is time to judge the initial whitening results. With the retractor still in place, use the shade guide to determine the after shade. Document in the patient's chart and with a photograph. Review the post-treatment care instructions with the patient and provide the card included in the kit for reference. Explain to the patient that the teeth are more susceptible to restaining over the next 24 to 48 hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages. Syringe the satin finish potassium nitrate and sodium fluoride gel into the completed take-home trays and seat them on the patient. We recommend a minimum initial wear time of 10 to 15 minutes. A complete application requires approximately half of one syringe. If the trays are not ready, syringe the satin finish directly onto the teeth. Dispense the take-home whitening gel for maintenance care to the patient. The remaining satin finish gel or a desensitizing product such as Relief ACP can also be dispensed to the patient at this time.